Good afternoon. I'd like to call the Health and Human Services and Aging Committee to order Wednesday, June 14th, and slightly a little after 1 o'clock. Madam Clerk, if you could please call the roll.
Good afternoon, everyone. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney is absent. Ms. Stevens is absent. Ms. Turner,
Present.
Mr. Miller,
Present.
you have a quorum.
Thank you. Anyone signed in for public comment, Madam
No
Chair?
public comment has been received.
All right, we have before us approval of the minutes from the May 17th, 2023 meeting. Can I have a first and a second, please?
First, so moved.
Second.
Moved by Miller, seconded by Turner. All in favor, please say aye.
Aye.
All right, there's only one item before us today. Maybe a little miscellaneous chat. So, Madam Clerk, if you could please read into the record the first item.
Resolution 2023-0163, authorizing a revenue-generating agreement with Cuyahoga County Board of Developmental Disabilities in the amount not to exceed $501,362.93 for reimbursement of staffing services for the DD Medicaid Waiver Program for the period January 1st, 2023 through December 31st, 2023.
All right, who is here to present to us today? And everyone that comes up to the mic, please have the green light on and state your name for the record.
Good afternoon, Marcos Cortez with Health and Human Services on behalf of Cuyahoga Jobs and Family Services. Again, as you heard, this is a revenue-generating agreement with the Board of Developmental Disabilities to provide and employ a sufficient number of Cuyahoga Jobs and Family Services trained workers whose assigned caseloads will exclusively consist of Board of DD consumers enrolled or seeking enrollment in the DD Medicaid waiver, or DD consumers who are residents or potential residents of long-term care Medicaid facilities. We will have 10 full-time caseworkers, 2 customer service aides, and 2 supervisors. Again, the start date is January 1st. We do have an option year for 2024 as well. The reason why we're late is the contract negotiations between the department and the Board of DD took some time to complete. And we have Director Merriman and Director Gowan unfortunately cannot be here today, but we do have Christy Nichols from the Department of CJFS and Amber Gibbs from the Board of DD who can provide some additional details on those negotiations and on the program itself.
Any questions for Marcos?
Yes.
Councilman Miller.
Are the services we provide essentially that of determining eligibility, or is it different than that?
I will ask Christy or Amber to come and address that more specifically, but I believe that is the intention, is that they will be determining eligibility for consumers seeking initial enrollment in those Medicaid waivers.
Good afternoon, Councilman Miller. That is correct. It is simply to determine eligibility in partnership with the the Board of Developmental Disabilities.
Christy, if you could state your name for the record, please.
Apologize, Christy Nichols.
And Madam Chair, to Ms. Nichols, in some cases, is the eligibility determination for nursing home services?
It is not for nursing home services. It's for what is called the ICF IID, and they are facilities for individuals with developmental disabilities. It's a very specific type of facility as opposed to a standard nursing home.
Okay, thank you.
Say that last part again. The ICF and the ICDs are facilities specific for what?
Individuals with developmental disabilities, which is why we work with the board on those, as opposed to a standard nursing home facility.
Is that an age limit or anything on that?
There's not an age limit. It has to do with the level of care and the types of services that they need.
Okay. Any other questions for Marcos? Or Councilman Miller.
So, Madam Chair to Mr. Cortez, I've heard the idea floated around from time to time from the Nursing Home Association that they would be willing to pay for some dedicated staff to help determine eligibility for nursing home services. And my question is whether we've ever discussed that or done anything with that.
To my knowledge, that has not come to me regarding those outside vendors paying for dedicated staff. It may have come up to Director Merriman or to Director Gowner or some other director, but I have not heard of anything like that. If they're interested, I believe they could reach out to Director Merriman and maybe we can begin some dialogue.
Okay, I haven't heard it recently, but I've heard it from time to time in the past. Thank you.
So, Mr. Cortez, this might be an Amber question, I don't know. So in terms of the revenue generating, are we caught up to date in receiving our funds, or where are we in this process? Whoever wants to answer.
Most likely because the contract isn't executed, we probably have not submitted invoices for reimbursement, so we were probably, almost 6 months behind.
So 6 months of invoices behind.
Well, since December, I would.
Okay, so we send our invoices to, I'm just trying to understand how this, I know you guys do this every day, and I try to really,
Amber Gibbs from the Cuyahoga County Board of Developmental Disabilities. Yes, they submit invoices to the Board of DD, and then we pay those invoices to generate the revenue back to the county. So we have not paid those since the January term.
okay. And the clients that we're receiving the funds for, are they our seniors or
They're all ages.
all ages? Okay.
It's a variety of people that we serve, and they're continuing to provide the services. We negotiated in good faith and knew we were going to come to an agreement, so we've continued to provide those services with JFS.
Okay, so now you need to
Now we need to
pay
pay for
us
them.
back.
Yep.
Okay, got it. Any other questions for anyone?
I just had a
Councilwoman?
point of clarification. It states that CJFS caseworkers are the only individuals that can complete these tasks, and that's why the exemption was granted. And it says it's been granted like this. We've been doing this for the past few years. What did we do before that?
From what I understand, this contract has been enacted since 2010. So it's most likely we would seek an exemption each time. So this is a government to government, so that's one of the exemption qualifications.
Okay, thank you.
So it'll always have to have an exemption?
Yes.
Okay.
Okay.
And Councilman Miller?
One further question to whoever can answer it is what were the sticking points in the negotiation that made this process go on for so long?
So there have been a lot of changes in the Medicaid systems over the last few years, from a change from a CRISI system that county board staff also had access to the new Ohio benefits system. And so we were making sure that we would still be able to realize the benefit of this partnership in terms of board staff being able to get information when someone's going to lose their Medicaid so that we can intervene promptly and help resolve that issue. So there was some discussion about when can we get that information, who can we get that information for. There's also just some discussion about working conditions in terms of hybrid versus all at home or all in the office, because the unit is in our space. So we just had to talk through some of those things that are different post-pandemic.
Thank you.
So a CRISI system to the Ohio benefit system? Okay. Any other questions or clarifications that are needed? Anything else you'd like to share, Marco? So this is actually, are we extending this? Or
This is,
a
I
new?
believe, a new contract with an option year for 2024.
Okay, so a totally new one. Okay. You have to do this every year?
We probably do it every 2 years once
2.
we exercise our option years.
Okay, so
might
this
look
is
at-
our option year.
This is the first year
First year.
And then we'll
Got
have
it.
one more option year.
Okay. 2-year.
Because-
I know some do 2 and some contracts do 3
Yeah,
or
so-
2 years with the option year.
Yeah, I'm not exactly sure why we only have 1 year. Sometimes like you said, when we do an RFP, we put 2 or 3 year options in there.
Okay, option years. All right.
The only thing I would ask is if we could get it approved on second reading, just
Of
because we
course.
are.
That's why we're having it today. I was trying to push it back just to, have a full meeting, but that's okay. I understand the need. So I'll make a motion to move R20230163 to the full council under second reading suspension. Is there a second?
Second.
All right, it's been moved by Conwell, seconded by Miller. All in favor, please say aye.
Aye.
Thank you.
Very much.
Your microphone, Madam Chair.
Any miscellaneous business from anyone? Well, I just wanted to share, if you did not know, to my colleagues that I have started the process to meet with all the HHS directors. You're more than welcome to sit in on any of those meetings. Levine has the schedule. They have started, we've completed one. We have 7 more to go, and they will start, they've started now, and they will go into the end of July. A couple of the directors at some of the major agencies really wanted to take a look at what the state is going to provide, and getting some feedback from our fiscal director, Walter, before they sit down and meet with me and Levine. But always open for you guys to join in. If there's any questions and you can't meet on those days, send it to me and Levine, and we will incorporate it into our meetings. And so, with anything from anyone else, anything else further? Doesn't look like it. Meeting adjourned.
Madam Chair.